After the first cases of Ebola in North America were diagnosed, Windsor area hospitals began preparing for the possibility of a local case. Ebola, a hemorrhagic disease, is spread through contact with contaminated blood or bodily fluids. Because of this, healthcare workers must be especially prepared to deal with potential patients. Windsor Regional Hospital held a media presentation on Monday, October 20th, to inform the public about their preparations.
What we wanted to do is to provide an opportunity to engage the public and to let them know what it is we've done at the hospital to prepare for a possible situation where we would have an Ebola patient.
Hospital staff presented their PPE, or personal protective equipment, procedures and safeguards, with a live demonstration of standard protective equipment. Due to the length of time it takes to put on and take off the higher protective suits, media were unable to see those suits in action.
So with this one, you can see we've got a full coverage bodysuit. All the zippers and everything are fully contained and lined. We also have boot covers, so you're not contaminating your shoes.
Dr. Paul Bradford, an emergency room physician at Windsor Regional Hospital, says area hospitals have more work to do to be prepared for a potential case of Ebola.
I think what we need to do as a region, though, is have a plan that we can work together. There's many different groups of us involved, and each of us is getting different pieces of information from their bosses, if you will, right? And depending on how it's interpreted. So what we want to do is have an exercise where we bring everybody together and say, okay, let's just role play some scenarios.
According to Bradford, the best defense for an average person against any infectious disease, including Ebola, is simple hand washing. For MediaPlex News Now, I'm Angelica Haggart.